This adjustment for the knee is especially great for any patient who presents with nondescript knee pain. Something that you've done all the orthopedic tests, maybe even advanced imaging, cannot detect an issue with the patient's knee, yet they seem to have pretty specific pain where a certain activity always causes it. Maybe it's a dull ache that happens constantly, but it's not point specific. The patient can't point and say it's right here. It's just sort of the whole knee. Or sometimes the pain moves around from point to point. So this is a great general adjustment for the knee. Obviously, a thorough exam needs to be done first, especially because with this adjustment, we're going to be initiating anterior glide of the tibia on the femoral condyles, which means that especially the ACL needs to be evaluated to make sure that there's no injury, strain, or tear there. So what we're going to do is have the patient's knee slightly bent, and I'm going to straddle their leg and hold just above their ankle in between my knees. Now I'm going to use 2 thumb contacts on the inferior patellar poles on either side, and in this position I can initiate flexion of the knee to find a really great spot where we can open up the joint optimally. You can also test for internal and external rotation restriction in this position and find if there's any restriction there. You can add that into the adjustment as well. From here, I wrap my fingers around, holding on to their calf with my fingers in between the 2 heads of the gastroc. And here you're just going to bend and hop backwards, initiating anterior glide of the tibia on the femoral condyles.